Joining us now, my good friend, Dr. Roger Klein. We've been doing this fraud thing. We haven't talked about COVID-19 and things of that nature, and he's with us now. Dr. Klein, it's good to have you back, man. Thank you for emailing me.
Yeah, thanks, John. Appreciate coming on.
I'm in Georgia. I've been here since the election was over. So what it's been about a month, right? Been five weeks. I've been here 5 weeks. Georgia, when you're here, you're not really affected by the lockdowns because there's not really one. You want to go to dinner, you go to dinner. I mean, you put a mask on, but you do what you need to do. You go to a Georgia football game, they got 25,000 people in the stands. I mean, it's just very limited impact, but that's not the case in some of these states that are imposing new lockdowns. And one of the things that we hear over and over and over is hospitals are being overrun, right? There's no beds. Now, COVID's been going on since March, so we're talking 9 months, and they've been telling us about no beds for 9 months. Yet, in the 9 month period, doctor, there's not a single hospital in a single city in the entire United States that ever ran out of beds. And this doesn't include the beds that each governor has set aside in case of an emergency that aren't in any of the calculations. Why do they keep lying to us about hospitals being overrun?
Well, I think there is an issue on the ground where they're getting strained, and I think it isn't that we are seeing a lot more hospitalizations, but I think people are first of all, they're tending not to be as sick, so they're less likely to go to intensive care units. Look, this has been a political issue, much more so than I think a rational medical scientific one. I think there are legitimate concerns about strains in hospital capacity, but on the other hand, a bad flu season, we see people sometimes being treated in makeshift facilities as well. So this has been unfortunately has been I think politicized, and part of what I'm reading Charles Atkinson's book, which I don't know if you've read it, Slanted, terrific, but it's a narrative. They've got a narrative, and they've got to play that.
Where do we go from here?
Well, look. First of all, I do want to say, I was just looking at the data, and the number of cases, which are diagnosed cases, in over half the country is now flat or decreasing. But I think we need to expect that the virus will continue to spread while people are inside. On the other hand, I think we're not seeing a whole lot of flu, largely because people are staying away from themselves. So I think it'll continue as it is. People protect themselves who need it. It's going to continue to spread. People will get infected. They'll get immune that way. Other people are going to get a vaccine as it rolls out, and the next year or so, within the next year, it's going to die out. The epidemic will start to go back to normal.
John Fredericks Radio Network. We're with Dr. Roger Klein, long-term guest on the John Fredericks Show, very involved in this line of work. Doctor, is there going to be herd immunity, or is the vaccine going to wipe this out? Like what vision this out for us?
Yeah, so that I think that's the term people use. I tend to use it less. I just kind of say population immunity. You got to get a certain number of people who are infected or develop immunity through a vaccine in order for the virus to start running out of places to go, stop spreading, and then it kind of dies out. And that's what. Yeah, of course. There's really no other way for this epidemic to burn itself out. We have to reach a certain level of immunity. It's basically a virus that's, it's like a bad flu. I mean, it'll kill, especially for older people, it can be dangerous. So, maybe three times the flu, it's a little bit more easily spread, maybe a couple times or 3 times the flu. So it moves faster, and it can be lethal, a little bit more lethal, especially at the older age groups. But I think in general, it's got to run its course. It's basically like a flu that we haven't seen before, and we have to get immunity to. There's no other way to get this under control. The question is, how do we get there? Is it through more vaccination and fewer infections, or more infections and fewer people vaccinated? But in the end, they're both accomplishing the same thing. An infection is a vaccine. The same thing.
So everybody that gets infected is not going to get affected again, so they build up the immunity. Vaccine seems to be days away, weeks away, a week and a half away. It seems to be very, very close. So we get a vaccine. What happens? In your judgment, Dr. Klein, do we roll this out nationally? Does everybody take one? Are people going to resist it? Is it really going to work? Is that when we have it? Is that the answer? Because as soon as we have it, everybody will start complaining that they're not getting it. It's going to the wrong people. So that'll be weaponized, the next day. So we're all expecting that. But when we get a vaccine, will people take it, and will that be the end of it?
Well, first of all, if Biden becomes the president, as soon as he's the president, the rollout will be perfect. It was horrible until he became president, and then it will be perfect. You have to understand that, so there won't be any problems at all. But and I'm being facetious, and you know that I'm talking about the way it'll be reported.
No, yeah, you're right.
Yeah, but I think that first of all, the plan is to get it out to healthcare workers, and that first, and nursing home people. So that's one of the main points. When we talk about straining capacity, one of the other issues is, if healthcare workers, they get sick too, then they don't have enough people to work in hospitals and that sort of thing. So I don't want to act like there's no problem. There is, but the question is what's the answer? But the other thing is then, 40 to 50% of the people who die are coming from nursing homes. So if we can get that population vaccinated, and most of those people are probably going to take it, I think we can prevent a lot of deaths. For the rest of the population, vulnerable people, it'll be rolled out kind of in essential workers. It looks like their plan, at least the recommendations nationally, each state's going to do their own thing. But then, older people, sicker people, and it'll progressively go down. And I think those people at highest risk are most likely to take it. As a 25-year-old, 30-year-old person necessarily going to go in and want to take it, they may not want to take it. There'll be some people who are afraid of it and, crossing categories, and they won't. They don't want to take vaccines, and so presumably they'll have the freedom not to do so. But there are people who just for convenience reasons and for reasons of low risk from the disease aren't going to do it. Remember, this is not Ebola. This is a disease that has the severity tends to be very age related, and if you're young and healthy, it's usually a mild. For most people, it tends to be a mild or even unrecognized infection. Look at Senator Grassley; he's almost 90, and he didn't have any symptoms. So I think we need to, you need to kind of understand people are going to make decisions based upon their personal predilection and also their personal risk or what they perceive it to be. So,
I agree with that. Obviously, we're adults and we have to decide what our personal risk is. And those, of course, that have had it, they have, I guess, no risk because you can't get it again. Obviously, you build up the antibodies. But I agree with you 100%. If Biden does become president, the rollout is going to be superlative. It's going to be the best rollout ever. The media will cheer it. Everybody's going to be fine. And then everything will get reopened and everybody will give Biden the credit. So we know that's happening. But I'm questioning the fact that who are there people that are just not going to take the vaccine? And are we going to get to a point, Dr. Klein, where like you have to have a card, like to travel on an airplane, that you have to prove you've taken the vaccine? Do you see that coming in the future?
I think it's possible, but the problem with so if what's going to happen is people are going to continue to get infected, and of course it's spreading more and more, and so they're going to people will get immunity that way. And remember, and by the way, it doesn't mean you can't necessarily get infected again. But I think, and we don't really know that, but I think once we start having some immunity, it's not going to be such a so harsh. It'll be probably like a regular flu-like illness. But I think I think a lot of people probably won't take it. But again, if you're 25 years old or 30 years old, I'm not advocating for people not to take it, but I'm saying, if you were that age and you're thinking about whether or not you want to go in for 2 different shots and feel sick for a couple of days and, you're going to take time out of your life, I just think a lot of people aren't going to do it. I don't think it matters. Those folks don't die. They rarely go in the hospital. They don't particularly get sick from it. So do we really need everybody? Somebody asked me, should children have it? Well, Look, kids can build up immunity. I don't think there's anything wrong with kids building up immunity to things that don't hurt them, And it's kind of like, we're treating this a little different than any other disease in my lifetime. I'm not arguing either way. It's just, is this really something that, for example, a child needs to have? I mean, they don't usually get sick from it. They're not particularly important as a source of spread as far as it looks. I don't think they're any better. I don't think they spread it more. I'm not sure they spread it less. I just don't know that people who are basically healthy need to have it. But I do think, I think you're right that it's going to be, it could become a political issue. But I suspect once the deaths stop, and once the vulnerable people get vaccinated, and people won't be afraid of it anymore. And once there's less fear, there may be less willingness to accept such mandates and less pressure for them.
Dr. Roger Klein, I really want to thank you for being with us today. As always, your analysis spot on. Dr. Klein, thanks for being with us. John Fredericks Radio Network. Always an honor to have you on, sir, and get your perspective.